Hi and Assalamualaikum to Dr. AZRUL. My name is Nuruliana binti Ibrahim, metric number D01910848. Now, I will present about my answer for my individual practical exam for QRU3193 subject. In this individual practical, doctor already give to us a situation that is Mr. Hafiz has suffering from left radial nerve fracture 2 months ago after fall from Apollo Horse. He underwent screw and plate operative procedure to stabilize his fractures. As time flies, some complications develop, and I, as a sport therapist, need to design an exercise to improve his condition. The first situation, he complains tightness at the chest. Therefore, you have teach one pectoralis major stretching based on frequency, intensity, time, and type. The exercise that I choose for pectoralis major is behind head chest stress. To do the exercise is we have to raise our arms and place the hands behind our neck, and then slowly bringing our elbow backward as far as we can. This exercise can be repeated to 12 to 15 repetition with 3 sets, and can do 3 times a week, and the time is follow as we can to do, as long as we can to do. The second situation is you notice that his deltoid muscles become weak. Please design one exercise for anterior, middle, and posterior fiber of deltoid muscle. Okay, now I will show the exercise for anterior deltoid muscle first. The exercise that I choose for anterior deltoid muscle is arm circles. The first step to do arm circles is stand with your feet shoulder width apart and extend your arm parallel to the floor. Next step, circle your arm forward using small control motion first. Stand with that position for 10 seconds. Okay, gradually making the circles become bigger. Do that movement until you feel a stretch in your anterior deltoid muscles. After that, reserve the direction of the circle backward. You do backward. Do the small motion first with 10 seconds also, and after that gradually making the bigger circle with also 10 seconds. Okay, now I will show how to do exercise at the middle deltoid muscle. Exercise that I choose for middle deltoid muscle is lateral raise. Okay, this is how to do the lateral raise. First, stand with a dumbbell in each hand at your side. Keep your back straight, base your core, and then slowly lift the weight out of the side until your arms are parallel with the floor, with the elbow slightly bent. Then lower them back down. For this exercise, aim 10 to 20 repetitions with perfect form. By the way, Selecting the correct weight is key to doing lateral raises properly and safely. The exercise that I've choose for posterior deltoid muscle is reverse band fly. The step to do this exercise is first, stand with feet shoulder width apart, holding dumbbells at your side. Next, press the hip back in a hinge motion, bringing your chest forward almost parallel to the floor. Next, allow the weights to hang straight down, palm facing each other. Next is maintain a tight core, straight back and slight knee bend. Next is exhale and raise both arms out to your side, squeezing the shoulder blades together. Next, keep a soft bend in your elbows as you pull your shoulder blade toward the spine. Inhale as you lower the weight back to the start position. Avoid hunching your shoulder up during the movement. Keep your chin tucked and maintain a neutral spine during the exercise. Focus on feeling the shoulder blades coming together with the proper breathing from start to finish. And the last step is repeat the exercise for 8 to 12 repetitions or as determined per set. For the last situation is, as the strength improves, you have to plan for open kinetic exercise using dumbbell to improve his biceps and triceps strength. Design an exercise to strengthen both muscle using feet. Okay, now I will show the exercise for improve bicep first using a dumbbell. The exercise that I choose to improve bicep muscle is reverse bicep curls. The first step that he has to do is stand with hands and feet shoulder, grip the barbell palms facing down while keeping your body straight and your chest have to fitted. The second step is holding the upper arm stationary, exhale and lift the bar toward your shoulders, bending at the elbow. Next step is continue to curl the bar toward your shoulders until you feel a complete biceps contraction. Next step, slowly lower the bar with control to the start position. And the last step, repeat the exercise for a determined amount of reps and set. The fit for this exercise is Mr. Hafiz has to do 12 to 15 repetitions with 4 sets. He can do 3 times per week, and the exercise also can do in 15 minutes. Okay, now I will go to the exercise to improve the tricep muscles. The exercise that I choose is seated dumbbell kickback. Okay, this is the way how to do the seated dumbbell kickback. Okay, first we have to sit down and then hold the dumbbell straight with our both hands. Okay, next, start with your arm bend and then bring the dumbbell next to your chest so your upper arm is parallel to the floor, and straight your arm behind you using your forearm, and then return slowly to the start position and repeat. For this exercise, the patient can do 12 to 15 repetitions with 3 to 4 sets. This exercise can also do within 10 to 15 minutes for 3 to 5 times in a week. Okay, that's all from me for the presentation. for the individual practical exam. I hope the individual test that I do is follow the criteria that you want. Thank you, Doctor.